Hello, this is the voiceover for the healthcare team collaboration and interdisciplinary delivery and roles, and also the cultural factors and healthcare that impact the health professional team. We covered the first portion of this discussion in class when we talked about the roles and the importance of understanding how we work as a team. And then I also clarified for readings that you'll find that your readings actually come from a number of chapters for this material, building on what we've done in the past. So just a quick reference to the chapters where most of the information for this PowerPoint are. Looking at the team, these are the roles that you want to be familiar with for your profession, and also just the impact that interprofessional communication has on patient outcomes. So we know that communication, many of you have pointed that out in some of your papers this semester, that it is super important. So some clinical examples or anecdotal examples of the different roles, and then tying it back to that nurse of the future competency that we are effective at through the use of interdisciplinary teams. So we're always looking for that seamless, coordinated care. And this was all based on the findings from the IOM report. So trying to eliminate fragmentation. So, and this is just a nice list of some of the outcomes that we could cite in the literature when we have improved outcomes due to increased use of collaboration. And then defining really what the components are of fragmented care. And again, it's that weak connection that exists. It's complicating things that should really feel easier than they are. And some of the symptoms would be the poor communication, repetition of services. And I think in class I mentioned, like a test that's done over and over again that we didn't need to do. And it costs money and it costs time and it puts our patient at risk for sure. So again, the solutions that we talked about briefly right before you left in class was to advocate, to look at that system and see where nursing plays a role in changing it. This case study you can take a look at on your own time, but it sort of looks into all the different things that happen when healthcare becomes fragmented. So a nice little picture when it comes to teamwork and collaboration. It really does take a village, a working village, to accomplish all that we need to when it comes to outcomes for our patients. So that was just a brief summary of what we talked about in class that day. What I'd like to move on to now is culture, and basically its impact on healthcare. Not only, and I love this Rockwell depiction of culture, but not only how it impacts healthcare regarding those that we care for, but also our own profession. And I spoke a little bit in class also to this in the national initiative, the ANA, putting out their recommendation that we have to increase diversity, that the faces of those that we care for should be a mirrored image in those of us who care for our clients. So it's just about acknowledging and acceptance, but really promoting diversity within our own field. So the Joint Commission does have its own Office of Minority Health that was established to address these issues of the lack of diversity in nursing, and being able to competently meet the needs of our clients when it comes to recognizing the unique cultural needs that individuals have, their language and the barriers to communication because of language, and really making sure that our nursing profession begins to develop itself in that way. Cultural competency, and Madeline Leninger is the theorist who speaks to cultural competence best, really it can be measured. We know this. It's measurable. So these were some of the recommendations that came right out of the IOM's report, and that we had to increase the diversity of students, right, to create that workforce that's better prepared to provide care across the lifespan and across cultures. And when we talk about cultural competency, we also talk about age. So to be able to deliver care to, perhaps like myself, a neonate, requires me to have some really intimate information or knowledge about the needs of very specific a newborn and the newborn's parents, because that's a dyad that is very important to understand. And that could be very different if I worked in women's health and just women's health, understanding the very unique needs of women versus men. Or I could work with the as a occupational nurse, knowing what the very specific needs are with the occupation that I am working with. So schools of nursing heard it loud and clear and have worked very hard to increase the diverse population within the programs that will be hopefully contributing to the next generation of nurses, the nurse of the future. So when we talk about the word diversity, I have a little list on this. Really what we're talking about, it's not just cultures, different, that we all come from different cultures, but racial is a part of culture, but we would like to see this disparity that exists change. So it could be where we come from, the color of our skin, the culture set that we belong to, which can be the culture of nursing is a culture in and of itself. And anybody who comes from emergency medical services or EMS or paramedics and then want to cross over to nursing, I often say it's a cultural leap for those individuals, because although they are proficient and well-versed in frontline rescue medicine, and it's life in an algorithm somewhat, and it's not exactly like nursing. And the colleagues that I work with who had a past life in emergency medicine will say to me that it was difficult for them to cross over culturally. Socioeconomic, sexuality, generational, age becomes a culture. So again, just a brief definition of culture, right? It's that complex. If you say culture to me, there's so many layers to that, right? Knowledge, beliefs, morals, art, customs, foods, habits, roles in society. Where's respect? Here in the Western culture, there's a significant amount of attention and focus paid to youth. But if we went to Eastern culture, the most valued member in the Eastern world is the elder. And here, everything, the focus here is staying young, right? And beautiful, and I don't want to grow old, whereas that's considered a beautiful thing in other cultures. So you can see where culture, I mean, talk about a shift, a paradigm. I'd be getting gorgeous, right? Anyways, so race versus ethnicity. Race, right, is what when we talk about race, it's the physical characteristics. So what race do we belong to? And when we ask about race, right, it's usually related to skin color, right? So, or really broad definitions. So those physical characteristics are, am I Latino? Am I Asian? Am I Caucasian? Am I African American? But it doesn't really expand upon ethnicity. When we talk about ethnicity, we're talking about something that's even deeper, right? It's not just my skin color, because I can be Caucasian, but I could come from an the Eastern Bloc, right? And my culture is going to be very different than the Caucasian from Canada. So skin color doesn't define our the broadest term of culture. Oftentimes it's the country and the nations and the ethnicity that we come from. Assimilation is the attempt for an individual to assimilate or become like the culture that they now reside in, or the attributes to that culture. So really, when we look at, and certainly we don't have to look any further than the political landscape right now that's occurring in our immigration debate here in our country, many come from all around the world to seek residency, refuge, asylum here in the United States of America. And some of the larger sweeping movements that in the past where folks have come from would be Eastern Europe, when we had the breakdown in the old USSR and the Soviet Union as it began to really just disintegrate, which left them in financial ruins. People were waiting for bread for days in line. Vietnamese, we've had a large immigrant population, Southeast Asia, from our South American and Mexican populations from the South. So really what this has contributed to is, and we also, what's not listed there would also be African immigration from many of the nations and Middle Eastern. So there's many that we could put on this list of who has sought asylum or refuge here in the United States. This has contributed to this beautiful, I feel personally, melting pot of patients. So my patients, I expect that they're going to be multicultural. I expect that they definitely are having it hold and behold a different set perhaps of values than maybe I do. And that makes me responsible as a nurse to become culturally competent. And that's what we're talking about here. When you get your first jobs as nurses, you will have to go through cultural competence. And it's usually at least an annual, if not every other year, competency that hospitals will require, institutions will require. The Joint Commission asks that we demonstrate that nurses are getting tested on and trained and then tested on cultural competence. So you can see there's a little video you can click on there, and Johnson & Johnson was the publisher of that video about cultural competence. I'm not, for sake of time, going to run it here. Great video. Please check it out. So we know that there's increasing diversity in nursing, and that we have to really actively recruit students. The thing with nursing is that you have to, in order to be successful in a nursing program, right, you have to have really strong academic performance in the high school setting or beyond, if it's a second career. And there's minimum competencies. It's a very select process to get into the program. And having come from an institution that was an urban, very diverse community college in the city of Boston, I can assure you that it was difficult. We were committed to increasing diversity throughout the city, but what we found, and this is a personal experience, certainly anecdotally I can share with you, was that if students didn't receive adequate high school preparation, it really made it difficult for students to be successful in the nursing program because, again, when we look at socioeconomic trends, students who came from the lower income, the poverty level lines were high in those schools tended to not have the same science grades from students from other communities. This is a political discussion, guys, one that I am certainly passionate about, but we can't have it here simply for time. But we have to recognize that. If nursing wants to boost diversity, well, then nursing has to get out there to the high schools, and especially in our high schools that are able to recruit because there's a misappropriation of resources and funds when we know that who's the at-risk student. I'm going to pause here and we'll move on to the next section shortly.